ass handed to them because the yoga instructor that is early 20s, that is usually, again, I'm just generalizing, will create a sequence that feels good on them, that kind of shows off what they can do. And then you have this person who hasn't exercised for 20 years, has a couple pounds to lose, has an injury, and then was like, holy crap.
Hi and welcome back. My name is Mila, and for those that don't know me, I'm a Pilates and mobility coach and the founder of In Studio, where we do personalized exercise programs. I'm a big believer that we should use exercise to improve our well-being as opposed to focusing on aesthetics, which don't always translate into a strong and healthy body. And so today I'm really excited because I am going to be interviewing Rafael. I would like to give Rafael the floor to introduce himself. He is a mobility coach like me, but I want to give him the chance to introduce himself, tell us a little bit about what he does and why he does it.
Awesome. How's it going, everyone? My name's Rafael, and I've been in this industry for 15 years now. And the biggest thing that I've seen in my career is that there was always a gap between personal trainers and physical therapists and chiro. So anytime someone got injured, they kind of fell in this weird gray area between those two that they didn't really know when they could go back to the gym or whatever activity that they were doing. And they kind of fell into this weird purgatory space. And I saw that in the beginning and I wanted to bridge that gap. So when I kind of got into movement and mobility training, I kind of saw that as the key to getting people moving and feeling better. And I've just nosedived right into that. And now I've kind of become this mobility rehab specialist person online and here locally where I live. And every single person that comes and sees me has been to multiple practitioners, multiple trainers. They've had a laundry list of injuries and they don't know how to get back into fitness and health without getting a flare up or whatever it is. And I'm that person that guides them in the right direction so they can, get back to their normal or compete at a high level. And I don't know, I just love getting people moving and feeling better. It's like one of the best things that a fitness professional can do.
Yeah, I like what you said about bridging that gap between or after rehab and actually resuming real life or activities that you love doing, which in my case, that's why I was so drawn to Pilates. It was for personal like rehabilitation that I was doing. And I think that's why something like Pilates is so trending. And yet there is so much more that it's missing in its practice that I find functional range conditioning, which is what both of us are certified in and like brings us together, I guess here, is how much more specific FRC is than any other method that I've known that really bridges that gap that you just mentioned, from the chirophysio to lifting, running, living life really.
Mhm.
Yeah. Could you tell me, could you explain what is functional range conditioning or FRC, and what makes it unique compared to other exercise methods in your eyes and your experience?
Yeah, so like functional range conditioning was developed by a chiropractor named Dr. Andrew Spina out in Toronto. And really it's a mobility practice per se, but it's so much more than that. Because when people think of mobility, they think of like, oh, someone's that's super bendy. But really, it also plays a role in strength. And how I look at mobility training, it's more so strength training for connective tissue. And that's where a lot of people kind of miss the gap in their training because when you look at the traditional strength model, it's very much musculoskeletal. How much can you bench press? How much can you squat? And then you get to kind of the tipping point of you're going for your max squat and something
Mm-hmm.
goes, your low back starts hurting. And that happens at the joint level where all that connective tissue is. So really the only time people do mobility training is when they go to physical therapy and chiro and they actually work those things. And then the moment they feel a little bit better, they go right back to their back squat. And then a couple months go by and now that old injury flares up and it's this vicious cycle. So when I found the FRC, it made sense. I'm like, this is what's missing. And what's interesting too is like I had Dr. Spina actually teach the course to me when I took it 8 years ago. And one of the first things he says is like, this is not new, but I've taken every single piece of literature on rehab, exercise, treatment, and organized it better than anyone else. So if you talk to a physical therapist of, what you're doing with them, say it's pails and rails, really it's isometric training. Like isometrics have been around forever. It's one of the most researched things in strength and conditioning. So the FRC is just a really well organized system. And once you understand the system and you put someone through it, you start seeing people progress really, really quickly, like to a point where people are surprised how quick it is. And it's not to say that, physical therapists and chiros don't know what they're doing, but you also have to understand what they're taught in school. What they're taught in school is to get you out of acute pain. The moment you're out of acute pain, you're kind of on your own, but that's where like the magic should happen, where you want to make sure that person's back to their normal and more, so that injury doesn't flare up. Because when you think about you rolling your ankle from hiking, the next day if you go to a physical therapist or chiro, they'll massage it, they'll laser it, they'll do some sort of maybe taping or some sort of movement. And the moment you can put weight on your ankle, they're like, yep, you're good to go do your thing. But that tissue's not at a capacity yet to actually take on the stress of hiking, running, whatever it is, so that injury is going to come back. So if you use FRC principles, you can actually increase the capacity of that joint, tendon, ligament, whatever is injured, and then keep pushing it forward. And that's where the strength kind of comes in. Because even like the idea of strength is kind of funny to me, because I would always ask this in my courses, like, what's your definition of strength? If you had a room filled with 30 people, everyone's going to have a different definition. And then my next question I always ask is, who's stronger, a powerlifter that can deadlift 1,000 pounds, or a black belt in Brazilian jiu-jitsu who could choke you out within 3 seconds? Like, two different types of strength, but it's specific to what they do. So really, it's like a lot of this stuff, and this is going like all over the place, but there's no like one right answer in fitness, right? And then when I find people who are very like, this is the only way, I kind of steer clear of them because we don't know enough. And even Dr. Spina says that like exercise science has been around 70 years. Compare that to physics and chemistry and biology. There's like laws you can't break in physics. Exercise science, it's very much like, oh, we took a group of people and placed them under a leg press machine to test whatever. Now go figure that out. But hopefully that kind of answered what the FRC is, and I didn't ramble too much.
No, no, that was great. You actually mentioned something in the beginning that I faced myself last year, talking to within the healthcare community. I spoke to a clinic, and I was talking to them about like this concept of bridging the gap, and they said something that you've just said, that I really, really don't like, and I wish it was otherwise. But when you're the physio or the osteo, their goal is to get you out of acute pain, and then they need to almost, they didn't say it like this, but it was understood, and like wash their hands clean, because they need to, also check the marker that they got you out of pain, and they're not, responsible for your next step or your re-injury, which is where the biggest gap is. Because a lot of the times when I see a client, they'll be like, okay, my physio, I'm better now. My physio said I can start running, but when I run, my knee hurts, so I can't run anymore. And if I continue, then it'll just make things worse, and then I have to go back to the physio. So it's this loop, but it's incomplete in the sense that you're coming out of acute pain. You're not going from not feeling pain, every day, or pain that takes you to the physio, but you're not at a point where you can run, lift, do sports of your choice without it, getting in your way. And FRC is really that system that gets you not just to a point where you're regaining mobility, but actually strong within that range of motion, which I think really sets it, apart from so many other methods, or, fitness these days. Then you talked a little bit about, mobility, and I want to touch on flexibility and mobility, because I feel like these words are used interchangeably, but there is a difference between the two, and you started to talk about it, and I just want to hear more from you. Could you just tell me more about, your what is flexibility, what is mobility, who should care about what and why.
Yeah, like that's one of the things I always teach in my courses too, is like the difference between the two. And really easily, like mobility is how much you can actively move your arm overhead. Whereas flexibility, if I take your arm and I lift you all the way up here and you're like way behind your head, that's flexibility. But then if I let go and your arm starts coming forward, that's the lack of mobility to actually get there. And I'm actually training a gymnast, and she's like the most flexible person you would ever meet. Like she can do a full seated split, pancake her whole torso. But if I asked her to lift her leg like actively from a seated split position, she can't. She struggles. And when you think about dancers in general, if you ask them like, how did you get flexible in the first place? I came an hour before class started, put in my leg on the parallel bar, held a hamstring stretch for 30 minutes, and then switched legs. But that stretch is just giving you flexibility but not controlling that range. So a lot of times when I work with gymnasts or dancers or someone who's hypermobile, they have all these like spaghetti noodle limbs, but you ask them to like just lift their ankle off the floor for say hip external rotation, their whole body is like shaking because they can't actually generate that force. So that's the biggest gap that I see, and that's where injuries happen. That's why like really flexible people, they tear their hamstring off, or they tear their like shoulder, or their shoulder pops out of their socket because they don't really have the braking mechanism like a car does in order to turn a corner really fast. And that's where injuries really happen too, is in your end ranges that you don't control. So if you think about, I don't know, a soccer player playing on wet grass and they go to cut laterally and they slide, if they've never taken their leg out there actively, the chances of them actually, not having an injury is quite low. So you have to train mobility as much as possible. Like it's cool to be super flexible because you can post it on Instagram and everyone's going to like it, but long term, it's not going to give you the benefit that you actually need.
Yeah, a lot of times people will tell me that they want to improve their flexibility, and I think many times they're actually talking about mobility, but they're saying the words flexibility because those are the trendy terms that I guess have been around for so long. And flexibility is this bubble where people think, oh, if I could be more flexible, my hamstrings won't hurt if my hamstrings were more flexible, or if I could touch my toes. Whereas that's usually sometimes being flexible without being strong in that flexible range is where you said is where most injuries happen, because your body can go into that range of motion, but it can't do anything useful there, right? You, we talked a little bit about what you do, and I would love for you to tell me the work that you do with yoga instructors, because I know that you do courses with them, both practitioners and the instructors themselves, because yoga is known to improve flexibility, and a lot of people perceive yoga as a means of getting them more flexible. Could you tell me a little bit about the work that you're doing with the yoga practitioners, and what role does FRC play there?
Yeah, and like a good friend of mine, Sydney, and I started teaching the 200-hour course for yoga instructors, and she's been a yoga instructor for 12 years and has taken every single yogi course you can think of. So when we teamed up to teach our 200-hour, we just looked at the gaps. And one manual that I picked up that's like a pretty big name in the industry, when I looked through their manual, the section on like fitness itself was 8 hours. And apparently that's enough knowledge to now teach a yoga class, teach a basically a boot camp in the heat, because now almost every yoga studio is doing a boot camp in the heat with dumbbells and stuff like that. So I saw that gap. And then when you look at what they actually teach you, it's very minimal. Like even the topic of biomechanics, it's non-existent in most 200-hour courses. Maybe it's different in different parts of the world, but at least here in Canada and the States, it's not really important apparently. Or even the idea of like how your nervous system plays a role in movement, or what to do when you're dealing with someone who has an injury. Because if you took, again, a yoga class and you had 20 people in front of you and you just simply asked who here has an injury, probably at least half of the room would put their hand up. And if you asked anyone, again, is anyone dealing with pain right now? Probably half of them would put their hand up. But then you have this sequence that you're going to give to every single person and in hopes that everything's going to work out. Like there's already so many things that are going to go wrong. And really, when you think about what yoga should be, is an experience and celebration of what your body can do. But if I have someone brand new that decided to actually, put their health first, they haven't exercised in a very long time, they go to this yoga class thinking that it's going to be good for them. And then they get their ass handed to them because the yoga instructor that is early 20s, that is usually, again, I'm just generalizing, will create a sequence that feels good on them, that kind of shows off what they can do. And then you have this person who hasn't exercised for 20 years, has a couple pounds to lose, has an injury, and then was like, holy crap, that was the hardest thing I've ever done. Like, that's not a good experience. And if we're in this industry to help others, like, we kind of have to have that idea. So a lot of times the people coming into my courses are already yoga instructors that have their 200 hour that are looking to get their 500-hour certification. And every single one of them would always come up to me after and go, I wish I had this when I took my 200-hour. Like, this makes so much more sense. And also, like, what I've learned teaching these courses is that a lot of yogis that have taught the courses previously, they're very narrow-minded. Like, you have to do this or there's no other way. Like something as simple as like the tree pose. Like there's so many yoga instructors out there, they're like, you're not allowed to put your foot on the inside of your knee because it's going to damage your knee. But like if you think about that mechanism, like how much pressure are you actually pushing into your knee? Probably not a lot. If you're doing that and you have a previous knee injury, probably. Or something as simple as like, am I allowed to have a slight bend in my knees when I do a forward fold? A lot of instructors are like, no, you have to have them locked out. And you're like, why? Because yoga is like that, right? Like you almost have to adapt and have like an evolution of fitness, and at least for yoga, it needs to kind of push the boundaries. Because the last 15 years of my career, I've seen people get worse. Like when I first started and I asked people about their injuries, it didn't really come up other than like, oh, sometimes my knee gets sore. But now it's like, oh yeah, I have a herniated disc, I have a bulging disc, I had my ACL repaired on my left side, ACL done twice on my right side, and then you're like, how are people getting worse? So I kind of realized that yoga also needs to kind of catch up. Like the fitness industry, I think on the mobility side is really pushing the limits, but on the yoga side, it doesn't really seem like it's progressing. So I felt the need to kind of do that. And like something as simple as teaching yogis about the nervous system and how if you have an injury, your body is literally shutting down the area of what's injured to protect you, which is great. But you almost have to relearn how to re-engage that area. So if I have someone's knee that's been hurting on and off, the idea of reconnecting to the knee tissues to get into a downward dog is probably not going to happen. So now you're going to probably overload your other leg, and then that becomes a problem. But if these yoga instructors know these little things, they can spot everyone. Like I tell people, like my yoga instructors, like in your class, you're starting with breathing. Watch how everyone breathes. That's your assessment. Like probably half the class is going to have some weird breathing, and you can already know that their nervous system's redlining. So maybe you can adjust your sequence or class for those people. If you start seeing people's shoulders do funny things or ankles are tight in a downward dog, now you can start adjusting. And I think, at least in the fitness industry, it's a lot easier to do those things where you see someone who can't lunge properly. Now you have like 10 different exercises that you can throw at them to make it a little bit easier. But in yoga, it's like, what can I do in a downward dog that's different? You never got taught that. So that's where I saw that gap, and I wanted to start doing that. And the cool thing is what we kind of developed is something called a fluid body class, where we kind of combine FRC kin stretch into a yoga class. And something as simple as like Warrior 2. Why can't you do a shoulder car in a Warrior 2? Downward dog. Why can't you do a hip car in downward dog? Like you can add these things. Or like the really cool thing is that we have this one student that's doing our full 200 hour for the first time. And she's, I think, 19 years old, super quiet, super to herself. And she's now at the end of her 200 hour course. And part of the fluid body course that I teach, at the very end, you have to take everyone through a class. And then she came up. She was the very last person to go, which wasn't like surprising because I know that like I could tell her anxiety was like getting to top levels. But like I was so proud of her. Like I couldn't have put a better class together. Like she put everyone in a chair pose and did double arm shoulder cars. I'm like, amazing. I love it. Like seeing that merge so well because you can get so many benefits from yoga. And then if you layer on top like true joint training, like best of both worlds. And even when we have people try our classes that are just general population, they're like, that was the coolest yoga class ever. Because a lot of times you go to a yoga class and it's kind of the same thing over and over and over again, and you don't really see the benefit. Because really in fitness, like you put an untrained individual into any kind of fitness setting, they will get better. Like they could have the worst program in the world, they will get better. But usually after that 6 month mark of doing mediocre stuff, they don't see progress. So then they start jumping to yoga studio to yoga studio to gym in hopes that some magical person is going to change everything, but it usually doesn't happen. And that's where the education piece comes in, is if I can continue educating all these yoga instructors and trainers to give what I know from the FRC perspective, they'll start seeing people progress and actually improve on whatever issues they're dealing with, strength or injury or whatever it is. But hopefully that answered your question. I kind of rambled all over the place there.
Yeah, I love that, and I've got so many things that I wanted to pick up on. One off is, I think, well, not I think, from experience, when I hear people talk about yoga and Pilates, well, I guess in this case, particularly yoga, people are seeking it for a specific reason. So their goal will be to, maybe starting exercise, maybe that's their idea of adding mobility work into their routine. So they're not doing it. I mean, I'm sure there are many who are, but most people that I know aren't doing it for any religious or spiritual reason. They're doing it for their own well-being, and what works for one person doesn't always mean it works for the other person. So when you're getting somebody with a knee injury versus somebody without a knee injury into that downward dog position, how they're going to respond to the exercise will be different, right? So a 20-year-old who's never had a knee injury is not going to feel all the pain and constrain of the tissue of the knee and everything that is affected by a previous injury in somebody that has had a surgery or injury or even discomfort in their knee. And the idea of perfecting a pose, we have that in Pilates a lot. I won't, this is quite a debateful topic online, but some people stick to how an exercise looks versus the purpose of the exercise, right? So with yoga, it's the same. A majority of people aren't there to perform these perfect positions and flows. They're just looking to get better. And so the idea of, being able to modify the exercise to the person, one is important. You talked about that, but one thing that I like is not just modifying or adapting, but it is preparing the body for a certain exercise. So when we're looking at, I'll say downward dog because I think it's one of the only yoga exercises that's coming to my mind right now, is something like hamstring flexibility. You can adapt the exercise, or you can improve your hip flexion, folding of the hip, the lengthening of the hamstring, so that you're not continuously adapting an exercise, but you're actually improving the body for it, which I think is important too. Is the idea of, yes, adapting the exercises when necessary, but getting your body to a point where it's free to move without having to constantly seek a way to change, or a way to modify things because they're afraid or they lack that certain mobility in their body. So I think that's one of the big benefits that this kind of approach brings into any system, right? Because it's not about poses, it's about feeling better, the body doing better. And you talked about the plateau that a lot of people hit. which is very interesting because it happens in all fitness, right? Everybody says, oh, you should, just exercising is good for you. Yes, it does. But after a certain point, unless you are loading the tissue differently, unless you're like changing that stimulus, you're going to hit that plateau and you're going to feel like, oh, this used to work, but it doesn't work anymore. What's wrong with me? And I think this is where that knowledge comes in, is that there's nothing wrong with the person who's at the plateau. It's just they need to take that next step. And so that education around how the body moves, works, how to overcome those, challenges effectively that prevent injury is important, because I've seen a lot of yoga practitioners that will come, and I've even had an instructor that will come and they have back pain because of doing back bends, etc. And from a practitioner's point of view, from a yoga teacher's point of view, many will push through it. And on the individual level, some will think, oh, maybe it's a bad movement for me. And I feel like both of those answers are wrong. It's just the body is not adapted to this certain position. And this is where, FRC will come in and will open up, or unlock is a bad word, but it will unlock that movement for you, if I can explain that more simply. So I think this it's important, yeah, to consider that when you've hit a plateau, maybe it's not bouncing from yoga studio to yoga studio, but finding an instructor that actually understands that next step of progression for you. With yoga, I do have one more question. Could you give me like a pain point that you face? Let's say somebody's watching this and they've been practicing yoga. What's a pain point that you'd say, okay, maybe it's time to kind of reevaluate what I'm doing, or maybe it's time to introduce a little bit of functional range conditioning into my practice? I can give one. In Pilates, something like a plank hurts the wrists, and very often we seek modifications, which is important, especially in a group class. But at times it's important to actually address the wrist and fix that. What is a pain point that you often see and you say, hey, like this is your sign to try out FRC?
I think the big thing is just knowing your anatomy, because even in the 200-hour course, all the manuals that I looked at, it was very much, here's all the muscles, here's all the bones, memorize them, and now spit it back to me in a test, and that's it. But if you take a step further in understanding what connects to what, how you can influence that tissue in a certain pose, then things get easy. Like the comment I had earlier about, locking out your knees. If I have someone with low back pain who has sciatic symptoms, locking out your knees in a forward fold is going to piss off that sciatic nerve. The sciatic nerve is a pretty thick nerve, and nerves hate being compressed. So if I have someone constantly teaching my entire class to always lock out the knees in a forward fold, then it's probably not going to benefit the person with that low back pain or sciatic symptoms. So I think the biggest pain point for me is like yogis in general and all fitness people should be reviewing anatomy. Like if you really think about it, like anatomy is very complex. Like if I had to put my hand on top of my forearm and try to memorize all the muscles going from the top layer all the way down to my bone, like that's a lot of stuff, right? And like most people who are in this industry, they got their certification, they memorized all the muscles and bones, and that was enough. But now to understand what it inserts where, what this wrist could be affecting to this elbow, and then you can start manipulating anatomy, because the amount of shoulder people I've worked with, for example, just moving their elbow from extension to flexion plays a huge role of how their shoulder feels. So if I know these things, it becomes so much easier for someone to understand, like, okay, maybe in a downward dog, rotating my hand so my shoulders go into more external rotation actually feels better on my shoulder. Then you just keep doing that. But a lot of times, kind of like what we were saying before, you have to fit a certain mold in a certain pose, and it has to look beautiful to be on the front page magazine of Downward Dog magazine or whatever you want to call it. But I think anatomy is like the biggest thing. Like I try to review as much as possible, but it's like it's challenging. But I think as fitness professionals, we have to kind of be better. So my biggest thing is like really review anatomy and understand what functional anatomy is, how it influences one thing to another, and what you can do in your classes, or even utilizing what FRC teaches to attack the tissue that's not working, because that's the thing that's going to be your weakest link, and that's the easiest thing to get better at.
Yeah, I like that. If I'm thinking of it from a non-instructor perspective, I've told my clients, if you've ever been to class, any kind of exercise class, and you say, why are we doing this, or how is this supposed to feel? If the answer is because this is the right way to do it, or you should be feeling your hamstring only, and if it's your lower back, then it's wrong. For me, that's a big red flag, because it's it's not representing the body, is just representing the image of the exercise, right? So this should look like this should feel like this, are usually red flags. And if somebody is experiencing that tension or discomfort, the idea is not to ever push through that, is to find somebody that really understands, as you mentioned, the anatomy, and how to, I don't know if the word they used was adjust or manipulate your anatomy, in order for your body to first feel better, and second, be able to do things more freely without, things hurting, and having that freedom within the body. So I think that's a really, really interesting thing for people to consider. Rafael, thank you so much for joining me. I would love to, I think, in the future, talk to you more about what you talked earlier about nervous system and how it affects movement. But I hope that we can save that for another time and dive a little bit more deeper into that, because I think a lot of people are really just trying to feel better versus chasing, images or unrealistic expectations. And I think people are kind of waking up from that toxic fitness culture, and they're seeking tools on how to make themselves better. So I really, really love this discussion, and I hope we'll get to chat again.